medical news at HBMS TV, Talking Health, brought to you by Mwanje Victor every Saturday at 12 noon and sponsored by C247, the next generation natural food supplement. And this week, we're looking at the lately reported rise in the cases of hypertension, and this is attributed to the COVID-19 pandemic lockdown. According to the Centers for Disease Control and Prevention, CDC, blood pressure is described as the pressure the blood exerts against the person's arterial walls. If a person has a high blood pressure, also known as hypertension, they are at a greater risk of stroke or heart disease, and hypertension can also damage the person's liver, eyes, and the brain. The Centers for Disease Control states that 47% of the US adults have hypertension, and in 2019, hypertension was the primary contributing cause of more than 500,000 deaths in the United States. To look at the blood pressure levels during the pandemic relative to the previous years, a group of scientists studied the data from an employee wellness program in the US covering 2018 to 2020. The research showed that there was a great increase in the cases of blood pressure in a study where over 464,000 people were monitored as compared to the figures reported before the COVID-19 pandemic broke out. The study furthermore showed that there was an increase in hypertension cases, mostly among women and also shockingly among the young children, which was not the case in the previous years. However, there is a big question posed. Why and how is the increase in the cases of hypertension attributed to the COVID-19 pandemic? Let's look at it. In response to this question, Dr. Luke Laffin, the coordinator of the Center for Blood Pressure Disorders at the Cleveland Clinic in Ohio, and the study's lead author, said that excessive consumption of junk food, lack of exercise, central obesity, excessive alcohol consumption, and not taking the prescribed blood pressure medications led to the rise of hypertension cases in the COVID-19 lockdown. Furthermore, the increased anxiety levels among the population. Since lots of people lost their jobs, they became redundant and lost their businesses, and they lost their income. All of this created a lot of stress and anxiety, and this also explains the increased cases of hypertension worldwide. Nevertheless, Home-Based Medical Services International, in partnership with HBMS TV, go ahead to encourage all of us to aim at having and maintaining the normal blood pressure, that is 120 out of 80 millimeters of mercury. And this can only be achieved through regular exercising, minimum of 30 minutes on a daily basis, and avoiding junk food, which are rich in cholesterol and rich in salts. Therefore, we should resort to consuming a healthy diet and also having at least 7 to 8 fruits and vegetables consumed on a daily basis, together with regular consumption of our natural food supplements, especially the choledoes, that's omega-3 fatty acids, together with C247, that's complete nutrition 24 hours, 7 days a week. And this play a key role in prevention and reversing of hypertension in our bodies. We encourage you all to stay safe and have the best of your day. Have a good time.